Coronavirus myths explored. As the coronavirus continues to attract attention, many lies surround the problem. We will discuss some of the coronavirus myths and conspiracy theories. The new coronavirus, now known as SARS-CoV-2, has spread from Wuhan, China, to all continents of the Earth except Antarctica. The World Health Organization, WHO, officially reviewed the classification of health emergencies of international interest in a pandemic on the 11th of March 2020. The virus has caused millions of infections worldwide, killing hundreds of thousands. America is the most affected country. As always, when the word pandemic begin to make headlines, people are frightened. And fear is accompanied by false information and rumors. Here are some of the most common coronavirus myths out there on social media and beyond. 1. Children cannot have COVID-19. All age groups can contact SARS-CoV-2. So far, most cases have occurred in adults, but children are not immune. Preliminary evidence suggests that even children can get it, but the symptoms are less severe. On May 15, 2020, WHO published a commentary on inflammatory diseases in children and adolescents that could be associated with COVID-19. This condition, called multisystem inflammatory disease, has characteristics similar to Kawasaki disease and toxic shock syndrome. Scientists now know very little about the condition. But from a May 2020 study suggests that it is rare. Probably less than 1 in 1,000 children exposed to coronavirus. 2. Only the elderly and young people are at risk. SARS-CoV-2, like other coronavirus, can infect people of all ages. However, older people and those with existing health problems like diabetes and asthma are more likely to fall seriously ill. 3. Spraying the skin with chlorine or alcohol kills viruses in the body. Applying alcohol or chlorine on the body can cause harm, especially if it gets into the eyes or mouth. People can use these chemicals to disinfect surfaces, but not use on the skin. These products cannot kill the virus in the body. 4. COVID-19 is like the flu. Coronavirus causes diseases flu-like symptoms, such as pain, fever and cough. Likewise, COVID-19 and flu can be mild, severe or rarely fatal. Both can cause pneumonia. However, the general profile of COVID-19 is more serious. Mortality reported in several countries varies. Scientists still calculate precise mortality rates, but they can be much higher than seasonal flu. 5. Everyone with COVID-19 dies. This claim is incorrect. As mentioned earlier, COVID-19 kills only a small percentage. In a recent report, the Centers for Disease Control and Prevention in China concluded that 80.9% of COVID-19 cases were mild. The WHO also reports that about 80% of people suffer from milder diseases and do not need treatment in a special hospital. Mild symptoms include fever, cough, sore throat, fatigue and shortness of breath. 6. Cats and dogs spread coronavirus. Currently, there is little evidence that coronavirus can infect dogs and cats. However, the virus was passed on to Hong Kong, a Pomeranian whose owner had COVID-19. The dog showed no symptoms. 7. Face masks always protect against coronavirus. Healthcare workers wear a professional mask that fits perfectly to the face and protects against infections. Disposable masks and cloth masks can prevent droplet, but cannot prevent aerosol particles. The Centers for Disease Control and Prevention, CDC, recommend that everyone wear a face mask in public places where it is difficult to stay 2 meters away from the other. This slows down the spread of the virus to asymptomatic people. And to those who are not aware they have contracted the virus. When wearing a mask, it is essential to continue with other precautions, such as practicing physical distance and avoiding contact with the face. 8. Hand dryer kills coronavirus. Hand dryer does not kill coronavirus. The best way to protect yourself and others from viruses is to wash your hands with soap and water or alcohol-based hand sanitizers. 9. SARS-CoV-2, coronavirus, is a variant of the cold. Coronaviruses are a large family of viruses, all with sharp proteins on their surface. Some of these viruses use human as their main host and cause colds. 10. You have to be with someone for 10 minutes to contact the virus. The longer you stay with someone that has it, the more likely you are to get the virus. But it is still possible to detect the virus. 11. Rinsing your nose with saline protects against coronavirus. There is no evidence that saline nasal rinses prevent respiratory infections. Some studies suggest that this approach may reduce the symptoms of acute upper respiratory tract infections. But scientists have not found that it can reduce the risk of infection. 12. You can gargle with bleach to protect yourself. Do not put bleach in your mouth. Bleach. There is no situation where bleach is beneficial to human health. Bleach is corrosive and can cause serious damage. 13. Garlic protects against coronavirus. Some studies suggest that garlic can slow down the growth of certain types of bacteria. However, COVID-19 is caused by a virus and there is no evidence that garlic can protect people from COVID-19. 14. Antibiotics kill coronavirus. Antibiotics only kills bacteria. They do not kill the virus. 15. A thermal scanner can diagnose coronavirus. A thermal scanner can detect if someone has a fever. But, other conditions such as seasonal flu can also cause fever. In addition, COVID-19 symptoms may appear 2 to 14 days after infection. This means that a person infected with the virus may reach normal temperatures a few days before the fever begins. 16. Alcohol reduces the risk of infection. In response to a number of myths about alcohol and COVID-19 pandemic, the WHO released a statement. In it, they explain that alcohol can disinfect the skin, but it doesn't work the same way in the body. They say, alcohol consumption is a health risk. High concentrations of ethyl alcohol, ethanol, can have serious health consequences, which can include death, especially if it contains methanol. In an information sheet on the subject, they write, alcohol consumption, especially abuse, weakens the immune system, thereby reducing its ability to cope with infectious diseases. People are more vulnerable to COVID-19 pandemic because alcohol is associated with many diseases. 17. Home remedies can cure and protect against coronavirus. No home remedy can provide protection against COVID-19. This applies to vitamin C, essential oils, silver colloids, sesame oil, garlic, aquarium cleaners, sage and all the water for 15 minutes. The best approach is to follow good hand wash programs and avoid areas where the sick can be. 18. Parcels from China spread coronavirus. Based on previous work on coronaviruses such as SARS-CoV-2, including those causing SARS and MERS, scientists believe that viruses cannot survive for a long period of time in letters or package for long. The low viability of these coronaviruses on the surface probably has a very low risk of spreading on a product or package for days or weeks at room temperature, explains the CDC. 19. You can get coronavirus by eating Chinese food. No, you cannot contact coronavirus by eating Chinese food. 20. You can get coronavirus from urine and feces. It is unlikely to be true, but the jury is currently absent. Modern and sensitive detection mechanisms can detect these viruses in the stool. Usually, viruses that can be detected in this way do not infect others because the stomach acid has destroyed it. However, keep in mind that some studies have shown that the SARS-CoV-2 virus can persist in the stool. A recent JAMA research letter also concludes that SARS-CoV-2 is present in the stool. 21. The virus dies when the temperature rises in the spring. Some viruses, such as cold and flu viruses, are more likely to be transmitted during the cold months, but the symptoms don't stop completely. As it is now, scientists don't know how temperature changes affect the behavior of coronavirus. 22. People ate bat soup, so the outbreak started. Some scientists believe the virus is of animal origin, but there is no evidence that it comes from soups of any kinds. 23. Coronavirus is the deadliest virus known to man. Coronavirus appears to be more severe than influenza, but it is not the deadliest virus man has ever encountered. Other mortality rates, such as Ebola, are high. 24. Vaccines against influenza and pneumonia can provide protection against COVID-19. Since SARS-CoV-2, coronavirus, is different from other viruses. Existing vaccines do not prevent infection. 25. The virus came from a Chinese laboratory. Despite rumors on the internet, there is no indication that this is the case. Recent studies have even shown that viruses are natural products of evolution. Some researchers believe that SARS-CoV-2 may have infected humans via pangolin. Some believe it may be a bat infection, as in the case of SARS. 26. 5G helps spread coronavirus. As the world becomes more connected, some regions have adopted 5G mobile technologies. Wherever this technology is rooted, many conspiracy theories are emerging. One of the more recent theories that emerge is that 5G is the reason for the rapid worldwide spread of SARS-CoV-2, coronavirus. Some argue that 5G helps communicate viruses, but often relies on a 2011 article that concludes that bacteria can communicate via electromagnetic signals. Experts dispute this theory, and SARS-CoV-2 is a virus, not a bacterium. Wuhan, one of the first cities to test 5G in China, explains the origin of these theories. At the same time, Beijing, Shanghai and Guangzhou also launched 5G. Also note that COVID-19 has had a significant impact on countries where 5G was barely covered. 27. Injecting or consuming bleach or disinfectant kills coronavirus. Consuming or injecting disinfectants or bleachers does not remove the virus from the body. Disinfectants and bleachers are powerful oxidants that help kill bacteria. Do not take or inject these drugs, as they can cause severe tissue burns and damage to blood vessels. 28. You can contract the coronavirus in swimming pools. As the CDC points out, there is no evidence that SARS-CoV-2 is transmitted through water in a swimming pool, spa, or water park. If this water is disinfected with chlorine or bromine, it should inactivate the virus. However, the virus can be transmitted in all common ways in shared spaces and elsewhere. Humans become infected with SARS-CoV-2 by inhaling respiratory droplets containing the virus or by coming in contact with the infected surface. Like other public places, the CDC recommends staying within 6 feet or 2 meters of others in swimming pools and water parks and wearing a mask when exiting the water. Pool operators should pay particular attention to cleaning and disinfecting all facilities. The big question is, what should we do? The CDC recommends the following simple steps to reduce the spread of SARS-CoV-2. 1. Avoid close contact with people who are not feeling well. 2. Avoid touching your eyes, nose and mouth. 3. Stay home when sick. 4. Sneeze into a disposable tissue and then throw it or sneeze into the hole in the elbow. 5. Use standard cleaning sprays and wipes to disinfect frequently touched objects and surfaces. 6. Wash your hands regularly with soap for at least 20 seconds. 7. Use a face mask to cover your face in shops, pharmacies and other public places. 8. Use an alcohol-based hand sanitizer when soap and water are not available. Before you go, I will love to hear from you in the comments section below. If you have any experiences, questions, comments, suggestions, etc., which you would love to share, please leave a comment. I promise to reply. Please subscribe, like and share this video. Thank you for your time.